And every time we take that and we take only the meat, well, people give us and tell us to take only the meat things they did. Some people believe in God, some people believe in Jesus, and they say, well, what would Jesus do? Well, sometimes he will overturn tables because it's
Come
there.
on.
You know, it's overturn the table and say, I'm being like Christ. Excuse me, boom. You know what I'm saying? You know what I'm saying? Get
Yeah.
you a rider that'll cut off somebody's ear every now and then. You know, like I ain't saying cut off nobody's ear in real life. I'm saying sometimes
Come on,
you have
Peter.
to have people that will go to the mat because as we see in politics, there are people willing to go to the mat to oppress you.
Yes.
You know, and that's how intense you have to be about your freedom. And so
Mm-hmm.
sometimes you got to read what they're doing and prepare, right? So a lot of times
This is the Black Gay Agenda. Let's get into some things.
What's up, everybody? What's up, everybody? Welcome to yet another episode of the Black Gay Agenda. I feel like this off season has been a whole entire new season with as much content that we've been giving you. But I hope you've enjoyed it. Make sure that you give us a rating and review. So actually, pull your phones out while we're doing our intros. Okay, pull your phones out. Especially those of you who's on Apple Podcasts right now, and go down, scroll down, leave us a rating, leave us a review. Let us know what you love about the show. Let us know what you like about our show. And hey, if you somebody who hates the show, let us know that too. And we may consider what you have to say. All right. Anywho, it's your boy, it's Micah B. And I'm gonna go around starting with you, Justin. Let us know how you are doing.
Hey everybody, of course, it's Justin B. Smith here. Honestly, I feel really good today. Today was a very, very productive day. And I feel like productive days always amplify my spirit because I feel like I'm actually doing real work and I'm actually contributing to the world and my community. But yeah, today was very chill, productive, and had some me time. So I can't complain. Thank you. Thank you for asking, Micah. Appreciate you.
Mm-hmm. Alex.
Hey, I am good. Of course, it's me, Alex T. I'm good. Today was good. Kind of did a little bit of work in the early part of the day, middle part of my day. I'm gonna be honest. I was on that Fortnite with the peoples for a little bit. Then
Work from home.
work from home.
That's why Trump said no more working from home.
Well, my job, I'm qualified to do what I'm doing from home the way that I do it. So Donald Trump can go to hell. But yeah. Okay. But yeah, no. Other than that, it's been a chill day. Really, I was just, prepping for now and waiting and excited to talk to our beautiful guest that we got here.
Awesome. And then we have two special
Yes.
guests with us tonight. We're gonna give them real good. We're gonna go over their bios here in a little bit. But Eric, starting with you. How are you feeling?
Hey everybody, I'm good. I'm good. Considering everything that's going on in the world today, I'm hanging in there, and I'm
Yes.
happy to be on here with you guys and Dr. Green as well. So this is the highlight of my day. So
Oh well, that's a blessing to be the highlight of your day. So
Okay.
honor.
absolutely.
Okay, period. And Dr. Green, how are we feeling tonight or
You
today?
know what? I'm feeling all kinds of things. I feel happy, resilient.
Mm,
I feel ready. You
yes.
know, I feel like, never before have we had an opportunity like this to double down on our tribe. So
Mm.
find your tribe, get linked up, get connected, and get ready because it's on. But we have everything in us to do what we need to do.
We needed
Amen
to
to
hear
that.
that. Our audience
Absolutely.
needed to hear that. We're going to get into some things, but before we get into the break and before we go over your introductions, we do a segment here that our audience loves. It's called the Twitter Talk segment. I go ahead and I pull something that I've seen on Twitter. One of us pulls something that we've seen on Twitter, and we want to talk about it. Now, I've actually saw this tweet this morning, early in the AM, and I was like, well, this actually goes right along with what we're talking about with sexual health and wellness, right? So somebody y'all DKJ, that's YALLDKJAY said the following and included like a little funny meme of Issa Rae as Issa D on Insecure. And the post says, people who buy lube in person are the strongest for real. Okay. And since we have healthcare professionals, we're gonna talk about that, and everybody's gonna weigh in because I've seen, there was a time in the past where even myself, like, I didn't want to like buy condoms in person,
Absolutely.
lube in person, fleets in person, right? Things like that when it has to do with sexual health. And so one, do y'all see, why do you think there's a stigma around buying things of that? And two, I also want to get into a secondary question after that, because we do see, speaking of lube, and since y'all are expert professionals of sexual health and wellness, there's a lot of people who use alternative lubrications, and I want to know, and my audience probably needs to know, is that okay? I'm talking about Vaseline. I'm talking about
Spit.
baby oil gel. I'm talking about spit. I'm talking about Alphaline. I'm talking about Ernestine. I'm talking about all of these
All the
things
steams,
that.
okay?
I said Ernestine. Who's she?
Because it rhymed with Vaseline. I said Vaseline, Alphaline, Ernestine. Are those things that people should be using for lube? And we can start off with either question first.
Look, we went on the medical professionals to
lead
lead us
My-
to lead us
Take it
Since
away.
everybody
mountain.
acting like we ain't all here Southern parents doing it too, so yeah. So why are we often in a space where we don't want to buy lube in person? Shout out to people who buy it in person, break down barriers. Those are my people. Why? It's by design, right? Since we arrived in this country, people want to own yours, especially when it comes to Black people. People fetishize our bodies, our abilities, our talents, our creativity, and certainly our sex. All the while they'll try to make us ashamed of it. Like, they'll literally tell you that whatever you got, your body parts are somehow abnormal or unattractive. Straight be under the knife. You hear me? Go under the knife. We'll visit the valley of the shadow of death. You know what I'm saying? Under anesthesia, just to have what you have all the time, making you ashamed of it. So that's why a lot of times in our communities, people are ashamed to do that, because it's not the same in other communities, right? And it's by design, because think about our sex. Certain other cultures used to own our sex, used to stud our Black men out. You know what I'm saying? Used to ravage and rape our Black women, and so it's by design. So I love that you all are even opening up this topic, because we study undoing those things, study every day. You know how every day they wake up and try to find a way to oppress you. Every day we wake up, right? Because we about them blanking gangs. I don't know if this is a family show, but we about them gangs. You know what I'm saying? So every day we wake up. And we go and we get free, So, hey,
Exactly.
free your body, free your mind, free your sex. I'm all for it.
Hello.
That was so good.
I love it.
And that stigma, it translates into further into care for sexual health, whether it be for HIV, other STIs, prevention. Not prevention. It prevents folks from going to get tested. And and that's just a cascade effect on how certain diseases can affect our bodies as Black people.
That's so good.
Yes, people have primary care that don't know their sexual orientation. How? How? If anybody needs to know, that's who needs to know.
That's right. That's right.
Exactly.
Or who are uncomfortable. Like, so one of the safest places, well, it can be a dangerous place too, but when you're talking to your primary care and they're asking you, like, how many partners do you currently have? And then you're in there and you're like, just one, knowing that you got multiple partners, which is nobody's shaming, but it's like, I've seen that, like, people are afraid to tell them because they don't, out of fear of judgment. I think that's what it is, out of fear of judgment. Because if you don't want to go in there and be like, oh, I got it buzzed down by 3 people, they be like, well, so people won't say anything, so then they lie. But when you lie, you're not really taking care of yourself and your body.
Exactly.
But then go ahead.
Oh no, I was going to add, like, ultimately you're avoiding the truth, because at the end of the day, like, even just from my personal experiences, I find myself going to doctors that look like me. So, for example, I'm located in Washington, D.C., and I found myself going to it's a nonprofit organization called Us Helping Us, and basically this organization mission is to help Black and people of color across the LGBTQ plus spectrum, get the quality of health services that they need. And so for me, when I see someone that looks like me, and I feel safe, and once I feel psychologically safe, because if I'm not psychologically safe, I'm not going to be able to be vulnerable, and I'm not going to be able to share my story to someone, period. And I feel like I find myself going to spaces and going to organizations like them to better my health, but also share my truth, because when I share my truth, I'm automatically impacting our community. I'm automatically contributing to our community, because a lot of people are living in shame because of oppression and because of the external factors that contribute to their identity. However, I feel like when it comes to showing up truthfully, I think it's important that like you go to spaces and go to doctors who look like you, because you're going to automatically feel that need to be truthful and to be vulnerable, because you're going to be helped in a way that you need to.
Well, two things you just said that I just want to double down, and thank you for saying it. There is a pyramid in science that actually they looked at how people come into self-actualization or their own particular greatness. At the bottom of that pyramid, the base of that pyramid, it's called Maslow's hierarchy of needs. The base of that pyramid is psychological safety.
Yes. Literally.
So you may, and you paying your insurance premium to go in there, and it's wild business when you go to a doctor and they don't actually work for you, but they're getting the check. It's make it make sense. You know what I'm saying? And so it doesn't make sense. But if you don't have that psychological safety, then your time is wasted, your health opportunity. And so what does that mean? Another thing you said, Journal of American Medical Association, January 2024, they did a study and they found out that when people who identify as Black or African American have doctors that identify as Black and African American, that psychological safety is there, they actually have better health outcomes. Yeah.
Makes sense.
That's not
because you know what I'm saying? Because now you're dealing with and that's the layer. Like if you think of an onion, I always do this thing of an onion. This is my little onion, and you unpack every layer, right? Think about if I'm putting that onion together. Every layer, the little one, the medium one, you get bigger and bigger and bigger, is a layer of safety. So I always, and so when you first started talking about difference in culture and stigma and how we don't own our own body, it took me off into a tangent. We, the people of these United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, and provide for the common defense and our posterity, we ensure these liberties, their unalienable rights, that all men are created equal. Now look at who's in that room. Right, and they meant that. You think we said what we said? They said what they said. It was the people around, and those were the people in their mind back in 1776 who saw themselves and each other as men. They didn't see us as human beings, so they weren't talking about us then. And a lot of times, if you turn on the news, if you walk outside your door, Black men, you'll find out they're not talking about us now, right? Exactly. They don't mean us. We have to stand up for us. So what happens in a situation like that, if all the layers, so those onions, going back to my onion, same religion in that room, picture that room, you got 13 people, same religion, same skin color, same declared sexual orientation, right? Because if any of them was not, they was, not saying it, right? Same social status. Each layer of that onion was a layer of safety. So what happens if you don't? You're not that religion. You're not that sexual orientation. You don't have that skin color. You don't have those social connections, right? Those things unpeel the safety, and they create a situation where certain cultures are just protected, and the system is built for them. They was building that around that table when they signed it. They was building a system, and they have gone and executed exactly what they built. So, but not to be dismayed, because they had to execute it off our backs. That means we actually know how to do it. All right, I ain't gonna take up all y'all time because you ain't having
Hey,
We
look.
listen today.
nothing today.
Yeah.
That's good. You're teaching us, you're teaching the audience. So we are going to go to break.
Do
But
it.
before I want to go to break, I do want to kick it back down to y'all about that second question. Because listen, I see it every day, right? So are those alternative forms of lubrication? Is it okay? Should people be using it, or should they leave the baby oil gel for the babies?
I would say it depends
You
on.
said baby oil. I'm gonna say I didn't right now in this one.
I'm gonna say it depends on your safety sex practices. So, baby oil Vaseline does not work well with condoms. If you are using condoms, I know a lot of folks a lot of folks choose to use different types of contraceptives and ways to protect themselves, whether it be PrEP condoms, whatever it is. But I think that I don't want to tell anyone what to do, but I would say if you are using those types of safety measures, you should not use any type of oil-based lubricants like that.
Because they break down the integrity of the condom.
It will break down the integrity of the condom.
Yes.
Mhm.
Exactly.
Water based when you're using it.
But no hair grease, right?
No hair grease.
Hair grease.
I mean, no, I'm just kidding. I'm just kidding. No hair grease.
Whatever makes
No
the glass
bees.
slide.
No beeswax.
No, scientifically, no. It also is an oil that, so you putting the condom on, it's taking it off. It's breaking it down, and that friction is just like if you have any kind of adhesive or barrier oil, if you just keep doing this, can take off a multitude of things. So imagine oil in that friction and things like that. That's why hair grease, it don't really work, Yeah.
That just sounds painful.
Okay.
Is it?
It's
very much painful. When I was a younger girl.
From experience, have you tried? You had Blue Magic. What hair grease you had? The coconut or the
Blue Magic is
No, I had
Sofa 8.
This is the safe space.
Now that sound painful. I don't want no Sofa 8.
That was Sofa 8. I had beeswax.
Beeswax? I'm finna say that's a rough time.
Well, I guess that's a great way to end it and go to
Speaking of beeswax.
Y'all are listening to the Black Gay Agenda, and when we get back, we're going to really get into some things. So make sure you leave a rating, make sure you leave a review, and we will be back after this.
What's up, beautiful people? It's Justin B. Smith here.
Your boy Michael B.
What's up, everybody? Alex here from the Black Gay Agenda podcast. We're so excited for all we have in store for season 3. We can't wait to tell you all what we got going on. However, in order to make that happen, we need your help.
You.
We're asking all of our followers, all of our listeners, all of our personal friends to help support what we do by donating just $10. All you have to do is click the link in our bio and then click on donate.
We want to make sure that we continue to have the powerful and meaningful conversations, but do it at a bigger scale.
And as y'all can see, policies they're trying to put in place are trying to hold us back, but nobody's holding us back. We're only moving forward.
So, if you find it in your heart,
you can go ahead, go to the Black Gay Agenda Pod, and click the link in our bio.
Your support is going to help us continue having these conversations, building this community, and be that representation that we all need, especially with everything that's going on right now. We love you. Thank you so much in advance. See you season 3.
and if you can't donate, just hit that share button, because that helps us out as well.
What is up, beautiful people? Welcome back to the Black Gay Agenda, and this is the Sexual Health and Wellness Agenda. Before we actually get into our guests, I definitely have to tell y'all a bit more about Dr. Green. So let's get into this. Let's meet Dr. Green. Dr. Green, also known as Dr. 100, is a vibrant force in the healthcare world. This proud Southside Chicagoan keeps it real 100% of the time, talking about it all, period. Black health, sexual health, and community health. She's about the business of the community. We love to hear that. With an MD and MPH from the University of Illinois at Chicago, Dr. Green took her talents to Miami for a family medicine residency before diving into an HIV specialty fellowship at Rush University Medical Center. She's been on the front lines at the Ruth M. Rothstein Core Center. She served community as Chief Medical Officer at Howard Brown, and now she's taking things up the South and West Sides of Chicago as the Chief Medical and Health Equity Officer of Onyx Medical Wellness. Oof, that's
Sound
amazing.
black to me.
It's
Very
black. Where her patient roster includes everyone regardless of age and affirms all gender and sexual experiences. Maya also serves as board chair for the 530 Scholars Program and serves on the board of Life is Work and Chicago Task Force Prevention and Community Services, all laser focused on uplifting Chicago's Black communities. Y'all hear this, right? Y'all hear this. Dr. Maya Green leverages all the above not to stand out, but to improve how she stands for the community. Because anything less than 100, just in her style. I know that's my not really.
Come on, bio.
Right.
I mean,
I said black like 20 times. Black, and black. Yes.
Onyx. Black.
Black.
Charlie, you gotta switch it up a little bit.
Right. Use a different word.
Thank you very much. Yeah.
Of
Thanks
course.
for having me.
I love it.
Thank you all for having me. It's an honor to be here. Excited to talk about the topics we have. You know what I'm saying? Excited to connect with community, connect with so many people, and let's go.
Oh, that's right.
Love it.
And now, Alex, just take us away now.
Look now, I don't know if pray for me, Eric, Nurse Welch, that I get more.
Dr. Green is a hard act to follow. So.
Oh, you hear me? Them two together, I don't know what I'm gonna do. I'm just gonna read it and then we just go. But no, everybody, I'm excited to introduce Eric J. Welch, MSN RNBC, because I'm gonna say all the letters, right? Because you write them. He's a dedicated nurse leader and advocate for public health and healthcare equity. Eric J. Welch, RNBC MSN, has built his career around expanding access to quality care for marginalized communities with extensive experience in medical, surgical, emergency, and ambulatory nursing. He has led transformative initiatives to improve patient care, hospital efficiency, and workforce development. Most recently, Nurse Welch has served as unit director overseeing system-wide bed placement and hospital throughput operations. In this role, he led a team of nurses, managed complex patient flow challenges, and implemented process improvements to optimize access to care. Previously, as a unit director of staffing and nursing programs, he directed strategic workforce initiatives while serving on diversity and LGBTQ leadership councils to advance inclusive patient-centered care. Eric's passion for public health and serving marginalized communities was at the forefront of his work as an associate director of nursing at a federally qualified health center dedicated to the LGBTQ plus and underserved populations. There, he provided direct oversight for nursing care across multiple clinical sites, ensuring culturally competent, high-quality services. He also worked in corporate health management, emergency medicine, and medical surgical nursing, bringing a broad systems-level perspective to patient care and health operations. Beyond his leadership roles, Eric is a board member of a community advocacy group, a champion for health equity, and an active member of several professional nursing organizations. His commitment to reducing health disparities is deeply inspired by his grandmother, Emma J. Welch, who also graduated from Providence Hospital's nursing program in 1950 as one of the first Black registered nurses. First Black registered nurses. Okay.
No, that's right.
Her legacy of resilience and dedication to breaking barriers in healthcare continues to fuel his mission to create sustainable, equitable healthcare solutions. Eric holds a Master of Science in Nursing with an emphasis in executive leadership, a Bachelor of Science in Nursing with a career dedicated to healthcare accessibility, diversity, and innovation. Eric Welch continues to be a transformative force in nursing and public health leadership. I mean,
woo!
Did our hearts not burn? Is that what they used to say in the church? Did our hearts not burn?
Did your heart not burn?
Thank you. So those are both very, very, very impressive resumes, bios, like, and I'm sure we just scratched the surface as who you are, right? Both professionally and then also, outside of this professional work. But I think one thing that I want to touch on first is just each of you, little exercise, right? I want you to describe yourself using 3 words. So whoever wants to start off, you can go.
3 words, right? To describe
Yes.
myself.
Yes.
Um, I would say first one would be black. Very, very black. I love us so much. um, second word would be spontaneous. I'm pretty spontaneous. I'm pretty with it in my professional life, but in my personal life, I'm pretty spontaneous. And third word would probably, I think I would just say, it sounds generic, but caring. I feel like in order to be in the field that we're in and do the work that we do, and me specifically as a registered nurse, um, you got to have some care and empathy in your heart.
Mm-hmm. Mm-hmm.
That's so
I love
true.
that. I
Like,
love that. Go.
oh no, I was just saying like that's so real because like, even when it comes to even being like a nurse, right? Because you said like one of your words was spontaneous. There's a lot of times where you were in the ER where you got to make like these spontaneous decisions to save a life. Like one decision that you could make could make or break a life there. So, speaking of spontaneous, like have there been any times like do you remember like one moment where you were spontaneous and like in your workspace and it like impacted the situation and made it better?
Yes, I can think of many, many moments. I was an ER nurse for a few years in my career in downtown on the west side of Chicago. But I would actually, one of the most recent ones that happened, it took place with Dr. Green. Um, um, and as we were in clinic with Nexus, the program that we've developed. And we had a young person come in and they had been discharged from an area hospital with 4 bullet wounds in their legs still, and they came in on a walker. So we spontaneously took care of that issue. Uh, and my ER training came into play there, but it was moving and shaking for Dr. Green and I both. But it really um, it shined a light on what people are really dealing with out here, and
Mm-hmm.
how uh, all medicine isn't good medicine, and all physicians aren't good physicians, and all systems aren't good systems. So, sorry to kind of segue into like Nexus, but that is really like one of the main driving factors of why we started this, and to service individuals like that. They may not be the focus of our program, but we see anybody and everybody for everything. If you come to us, we take care of you, and that's really what we stand on, and some of the principles. But that's the most recent one. But things like that happen all the time, and you know I don't want to give too many descriptors about the individual, but they were of our community, and clearly had some other issues that probably, caused individuals not to give them the best care that they could have. They weren't very health literate, and so, you know, and unfortunately, sometimes in healthcare spaces, when we expect the best out of the people that are taking care of us, we don't always get that. So, and that's why our team is full of Black and brown people, and we care. We really, I'm honored to work with Dr. Green and the entire team of Nexus, but 2 other main folks are Dr. Burris and Dr. Campbell. Um, Honored to work with these 3 Black women who care about us. And yeah, so sorry, I went off on a little tangent, but
No, you're good.
No, you're okay.
First word, surprising, Black.
Mm.
Second one, I would say giving.
Mm-hmm.
And I'll explain that later because you said one word. Third one, I would say manifesting.
All right, so actually we can go right into it. Why giving? Why is that one of the words?
So I think, Eric, I don't know if we were talking about this and joking about it. So I grew up first, a couple of years of my life were in Nigeria, first 5 years of my life, not because I was born there. My parents are from here. I was born here. And my parents are those parents that was like, we taking our kids to the motherland. So, we was out, and I came back, grew up on the South Side. So everything, all the good things and all the things that were done because of the environment that was created for us by other people, all the things we do to survive, I got the opportunity to experience. It helps me to be that doctor we talked about earlier when Black people go to the doctor, because there's a lot of context and care that then a person doesn't need to explain to me. I already understand, but giving, why giving? So even, with all that, we are brilliant people. I'm able to move through that stuff, become a doctor, everything like that. And it's the heart that I believe my source gave me to allow me to see people like the source sees them. So depending on what people choose, I can give, I can give you that one, or I can give you this one. What I love for them, I think, Eric, we were talking about it, I was like,
we were.
And I love that for them.
Exactly. Whatever it is the occasion calls for.
I guess what button you push, It's a skill. Yeah.
I love that.
Yes.
So, all right, thank you. I like that that added perspective. So I guess my next question for you, how do I want to phrase this? So the work that y'all do is really important, right? And I know in the medical field, there's a lot of different routes that you can take, a lot of paths that you could take, a lot of things like, specialties that you can focus on. What made you just stop and say, this is the work that I want to do? What was your why? What is your why for the work that you do?
You want me to answer? Is that for me, for Eric, for either one of us?
Either one, yeah, either or both.
Well, I'll start. My mother, so my uncle, we were his chosen family, Uncle Bebop. His name is Robert Bolden. We called him Uncle Bebop. He was a Black gay man, brilliant, who died of age-related pneumonia in the 1980s. Now we know it was called PCP, but age-related pneumonia, we didn't know it back then. At the county hospital in Chicago. And, I was a teenager, so I wasn't allowed to go back there because at that time, because it was so new to us, they were quarantining people and, kind of making kind of isolation and barriers for people. But my mom, she's an adult, she can go. She used to come home. So I lived his, the last days of his journey through my mother's face. So she would come home crying so hard, I thought she was laughing. When you get the little hunch and you're like, like she would come home crying so hard about how the doctors treated him, how some members of his biological family didn't go visit him. And I'm thinking, what is this that's splitting families apart? Because they was like super religious. So I'm like, y'all supposed to be 10 toes down, getting ready for celebration of life, a little prayer circle, something, but some of them didn't even go visit him, and watching that pain, and then I remember looking on TV, they were talking about how small the virus is. It can cause that much pain. It can split up whole families like that. And now I know it's not the virus, it's stigma. We can talk about that. Stigma is an infectious disease of the mind, killing people daily, straight snipe, and so, but, once your mama cry, you basically, now I know my purpose, you know what I'm saying? I live every day trying to make sure. My mom also taught me something, and my dad. Instead of talking about the doctors, talking about what they didn't do in there, if you feel like you can you know, do it better, go ahead. You know how they say in our community, feel froggy, jump. You know what I'm saying? So that's what I want to make sure nobody ever experiences that kind of stuff, and nobody living with HIV has to feel that type of pain. So that's why I do what I do.
Yeah. So my why, I guess my why for healthcare and becoming a nurse is my grandmother. She was an inspiration to me and everybody in our family. But what led me to community health and specifically HIV care was being out in the community. I'm from the suburbs of Chicago, and I lived in Chicago for a good 15 years. Still in the suburbs now, but lived experiences with friends, talking about stigma and how I've seen, stigma impact people that I love. And really through those lived experiences and being that person that friends come to sometimes when they have issues, oftentimes actually, when you're the nurse in the friend group, folks come and to you with all kinds of things. And it really drove my interest and impact in HIV and AIDS care. And it's still a problem. It's a huge problem. So that's what drove me to it.
I love that. I love that. Well, I'm going to kick it over to Alex. That was a great insight on y'all's why and why you do it. I think it's important to have people who are in any health field. I think it's important to be passionate about what you do, because if you're passionate about what you do, you're actually going to help out the people who are coming to you for help. So I appreciate y'all for being passionate about the work that you all are doing, because it's very important.
Yeah, and before you go, I have to say something, because like I'm just so inspired. I gotta just get it out. Like I love how, because Mike, you touched on passion, and I was going to mention how passion can be such a driving force to sustainable change, and just seeing how like you both like went through experience, your lived experiences ultimately shaped you and helped you make those decisions of getting to the healthcare field. But I think just even being the change that you want to see in like real time, especially in public health, and specifically when it comes to public health affecting Black queer people and Black people of all spectrums, it is really inspiring. So it's just phenomenal.
That's absolutely true. So I wanted to get into a little bit of more about the organization, and what you all do, and so that we know, let the people know what it is. So my questions are more related to that. So if you guys, either one of you, could kind of give us more about the organization, the practice, and then with that, what makes you different as healthcare providers, or how do you stand out? I'll say that.
Well, we stand out because we stand in community. That's hands down.
Say that again.
We stand out because we stand in community.
Love that.
Hands down.
That's a
you
bar.
know it. You're right. Either you know what that means, or if you don't know, what that means. And when it's time, we stand up. So you know what? I just want to say too, a little moment. I'm almost 50, but you can't tell because it don't.
Black don't cry.
It don't.
Where?
Not inside.
I said that because I'm having these times when I'm reflecting on life and getting really emotional. I'll tell you about Nexus, and then I want to tell you about something I never actually told Eric. No shade, like it just came up because when I said we stand in, something we did during COVID. But we'll say that because I almost got emotional there. But so, during COVID, we saw a lot of people who say they care about community tucking their tails and running. You know, never before had I seen the thing like, man, if we don't stand up for us, ain't nobody really checking for us like that. You know what I'm saying? And we, a lot of times, not everybody, but a lot of times we tend to think that other people are some kind of standard that we supposed to be trying to strive to. Meanwhile, like I said before, it's our ideas, our creativity, our brilliance that is being pilfered. I must be 50. Where I pulled that word from? Pilfered. It's been charlatan. And meanwhile, we're trying to get to this gold standard that doesn't even exist. Look around, And so during COVID, I remember people, a lot of healthcare entities themselves going back and be like, you know what, we're going to lay back. We're going to wait for people to come to us, all this other stuff. People was calling off, doing everything like that. We're in the south side of Chicago. So they're like, okay, the north side, if you travel to London, China, then you deserve to get tested. And I was like, oh yeah, I'm going to need one of them testing tents on the south side of Chicago. Bet I'm going to make my own algorithm, and I'm going to determine, and I wrote, me and Eric was laughing about how I wrote this letter to these, very well-known, prestigious entities. Like, I believe this patient. I typed it out so I can just put the patient name in it because, history is history. I know what the whole time because we lived them, right? So I was putting the person's name. I believe so-and-so has COVID. I'm going to follow this, and I believe they need a test. Now, if they come up with COVID, and so, basically it said, if this person have a poor outcome after I've sent them to you, you can come. You can meet me outside, and in the legal sense, my MD, and a lot of people were like not working, calling off, all this other stuff, and whatever. I looked around looking for people to test Eric. It's like, so what we doing? When we doing it? Where we going? Where we going tomorrow? 7 days a week, we was out in the streets, and those kind of things, it really stood out in the pushback we got, for doing it. I was like, if I don't leave here, and COVID was a disease, you can die in 10 days, right? 10 days from now, I remember thinking 10 days from now, if I die and I don't go 10 toes down for my community ever in my career, I'm not going to be okay on whatever side chapter, whatever is next. It made me see, like, with all this stuff going, if you got to go out in a blaze on something in the community, you got to do it. So I left my former job as chief medical officer, and I started Onyx, Onyx, either like the other thing, either you get it or you don't, you know what I'm saying? And if you don't, maybe it ain't for you. Okay. But so I started Onyx, and me being an HIV specialist, I was seeing also the barriers during COVID. People couldn't get their medicine, all this other stuff, right? Enter Nexus. Nexus is an advanced linkage to care program that links people living with HIV or people who want HIV prevention. We focus on people living with HIV. We have been linking them in as little time as 21 hours, not to the care to the appointment where they're going giving them an appointment. We've been getting them in care and starting them in on medicine in as little. I think our shortest time was 18 hours. And so that's to give you a little picture, because I'm a little, nerd buff. There's an HIV treatment cascade that looks at once a person is diagnosed. Usually the goal is to get them in care within 30 days. They were shortening the national goal to 7. But so I get diagnosed, I get an appointment within 30 days, whether I make that appointment or not, in the care, I'm actually getting pills in 2 months and stuff like that. No, it's a pill in your mouth within 24 hours with us, and it takes it. So no barriers, no, I don't be like, I don't take your insurance. You know what I'm saying? No, because the system wasn't set up for us. So I just spent a lot of time over the last year or so trying to find ways to bridge the gaps, breach those barriers. And I was talking to some of my loved ones. They said, call it Nexus, because Nexus actually means the connection and bridge. The definition is the connection and bridge of two very important things. For us, it's the person and their visualized optimal health. So
thank you for that explanation of how it kind of came to be and getting there. Give us a little bit more about what Onyx is. Like, is it a clinic? Is it a medical center? Is it we come to the crib? You gonna put it? You're muted.
All of it, because that's what it means to stand in the community, right?
Yes.
We got you can go to be in clinic. We got patients. We'll roll up. We'll pull up. At your house. We'll do. We do those things when we can, and we have virtual access for people. So you're in the next city over, your next county over. Pretty soon it's going to be you're in the next state over, and you are recently diagnosed with HIV. You want to get into care. You reach out to us. You reach out to our phone number or scan the QR code or go to the website, and how they be like, okay, well, hold on, let me link you to the person. Surprise, it's that's gonna get you in the care and get you what you need. So that's what Nexus is. Onyx itself was formed as a original collective of 8 African American women that met in the field of social services and medical care to our community. I'm an HIV specialist. I family medicine. I still see people regardless of your status. We have 2 people that specialize in addiction medicine, and then we have 1 OBGYN. And then on our not-for-profit sister side, we have 2 pharmacists, a case manager, a nutritionist. So trying to build, and that our not-for-profit is Onyx 360, taking care of the whole you. So shout out to my sisters, So
I love it.
Before Alex jumps in, I had a follow-up. So I know from everything I'm hearing, it's amazing the work that y'all are doing. I can't echo that enough. So obviously y'all do care. Are y'all doing like prevention as well, as far as PrEP and Doxy and like these other things that people can take?
Yes, we are. We are doing PrEP and Doxy. We are treating folks who are positive for STIs. So we are giving holistic, confidential, and complete care.
So quick question for the people who don't know, because Doxy is, I won't say it's new. I'm sure it's not new, but as far as for a lot of us just finding out about it, I know our clear counterparts have been hit to it and us not so much. Can you let the listeners know a little bit about Doxy? Because there's some misconceptions about it. People say you could just do whatever you want and then just take your pill and you're good to go. Could you kind of like explain what Doxy is and what it isn't?
I be trying to see if Eric gonna go.
You want to spread the love.
Let me tell you, Eric's sitting up here like, go ahead, Dr. Green. Let me tell you, when I'm working with Eric, if he'll sit there and let me answer. Now, when we work with a client, I better be 100% the blank on, because he'll be like, you know what? I just wanted to know if you wanted to update it. The guidelines were updated yesterday. If you wanted to use
That's right.
Okay.
Or the recent most updated guidelines that are gold standard.
This is
now today, I'll sit on the camera like,
actually happened.
I mean, it actually happened. So Eric is brilliant. And I was like, okay, I know he knows it. So, all right. But Doxy is, in long and short, I call it a morning after pill. I call it a morning after pill that against, to some different degrees, gonorrhea, syphilis, and chlamydia for oral, anal, or vaginal sex. It's a dose of medication called doxycycline, and doxycycline is an antibiotic, and we know with antibiotics, you're right, you hit it right on. You don't want to just take them willy-nilly, right? You don't want to be the boy or the girl, the person that cry wolf. You don't want to keep using it. And then when, long term, your ability, its ability to be effective in your body decreases, right? We already know, so this chlamydia, we already know for gonorrhea, the effectiveness of Doxy is starting to go down, right? So no, to answer your question, no, you know, you should not just kind of be out there. At the same time, if an incident happens, because remember, there's a drive. I was telling somebody today, there's a drive in your head that says, experience these persons without any barriers. There's a drive. If we didn't have the drive in our head, we would fall off the face of the planet. Y'all understand that? So it's instinctual. So, you know, everybody, you know, shout out to everybody that think they're going to be the one that's going to spiritually or naturally just be so much deeper than the billions of people that have come before you.
No, for real.
We need to get you a cake, you know. So, yeah, so it's a natural instinct. We just want to, Doxy is away, and you have to take it within 72 hours. I forgot to tell you that, you know, and so you have to take it. And guess what? The 72nd hour is not as good as the first hour. So you can't be like, day one.
Right.
Me too. No, you know, no.
Let me see if I got another somebody lined up, and let me wait a day in between.
Get
That's insane.
Get a catch them in the bracket.
Exactly. And I think it's important to know for anyone who is new to DoxyPep, it does not 100% prevent anything. It just decreases the risk significantly.
Oh, that's actually good to
like
know.
that you said that, because I don't know how deep into like the Twitter world that you all get, and like just the tweets that people send out, me like, oh, I just did blaze, like, for instance, right? And we don't shame here, right? We don't shame here. We're a very sex positive podcast, right?
Absolutely.
But like posts like, oh, I'm going to Atlanta this weekend. I want to whoa. Glad I got my Doxy. So I think there is a lot of misinformation and lack of education where people think it is just I live my best life, pop my pill like it's a Flintstone vitamin, and just be on my way, and I'm good to go. And you're not necessarily good to go. So I'm glad that you all, you know, I hope more and more people start to amplify that, so people could just be more educated.
And misrepresenting what it is, because even if I know, me saying that and somebody else not know, now I'm misrepresented what it would actually do. You know what I mean? Like you said, so somebody else that didn't know is going like, oh, that's all I got to do. Let me go get me some of them. You know what I'm saying?
No, I was going to add to Eric what you were saying, because like honestly, even like my perspective of DoxyPep, I thought it was like 100%. I'm good. I just got to take this, you know, just take this morning after pill, and I'm good, you know. But I think it is important, and the fact that you even mentioned that, it just kind of makes me think like, girl, just use contraceptive, just avoid it all, you know. But I actually wanted to like mention one more thing, because Dr. Green, you mentioned earlier like how like in the midst of COVID, like there were a lot of individuals who weren't showing up for the community, and like you all were like often demonized for your actions when it came to showing up for those, and like, you know, in the community that didn't have the direct access to these resources. And when I think about it, I look at it as like a direct form of like radicalism. So like, I guess like I say that to say like, would you consider yourself more of a liberal, or consider yourself more of a radical in the healthcare force?
You know what? The word I would use goes back to a quick story I'll tell you. After I was in the group, it was an executive group, and they were like, we shouldn't have done that, you know, because we ended up vaccinating a lot of Black people. They're like, we took our eye off. We shouldn't have done it. And I was like, oh, no. You know, let me just, while we're in this executive, let me just clarify one thing. My community was done in 10 days. So if it happened again, I'm going to do it again. So I just don't want you to be confused about who I am. And they said, and here's the word, Dr. Green, I just want to stop you right there. I don't want people to think you're aggressive. I said, oh, I don't want y'all to think I'm aggressive. Oh my God. I want you to absolutely know I am. You know, dying in 10 days. I want you to know that I am aggressive, you know, to me and my community, you know, and a lot of times when they say that to Black men and women, to Black people, you know, because, you know, other people can be aggressive, other people can be go-getters and all this other stuff. And then when they tell us we're aggressive, they have taught us to kind of pull back and shrink.
Minimize our value.
Absolutely.
You know what I'm saying? Strength for the blank word. I'm on board, so I try not to cuss. I'll say that. But you know, shrink for what? So no, absolutely no, I'm aggressive, and I should be, because you have to be. If someone's not aggressive for our community, look around. Look around.
Seriously.
I got a brother, his name is Silas Green. He's like, he heard somebody say, if you don't know, this is, and he said, Maya, you a doctor, and it's a literal test. He said, this is how you know somebody is insane. You walk in a room and you literally, in the exam room, you say, do you know who you are? What's your name? Do you know what date it is? What time is it? Do you know where you are? So if you don't, I will say this, and like I say, either you understand or you don't. If you don't know who you are, if you don't know where you are, for real, and you don't know what time it is, you are the definition of insane.
Right.
Yeah.
And that's real.
Yeah,
That's real.
Yeah.
I want
And
to
Mike,
get Eric to talking a little bit more too. So I want to get into your role. I want to and because we know Dr. Green and the host of women that works along as far as the medical staff and the team that does what they do at Onyx, how do you support them? Like, what's your role, and then how do you support that team and do all you do?
I'm really just there for moral support. No, I'm just kidding.
Cheerleader.
No, my official title is Chief of Operations for Nexus.
Okay.
But what I do is support anything operational for the program. My main focus as of late has been really working on clinic flow, lab specimen processes, and just developing a seamless experience for our patients. So, our program is unique in the sense that we partner with community organizations. So, community organizations that typically hire from the community that they're serving. So, we absolutely love teaching, and we taught phlebotomy class. We taught folks how to take vital signs. We do a lot of education, and we're really exposing different communities to healthcare. So we and correct me if I'm wrong, Dr. Green. We basically went into a community space and we just built a clinic. That's what we did, and it's beautiful, and the people that we work with are beautiful. They care about what we do, just as much as me, Maya, and the rest of the team, the leaders of Nexus, and it shows in our patients and the care that they receive. So that's another thing that makes us unique and stands out. Like, the individuals that I have the honor of working with really care about our cause and our purpose, which makes for me, it makes this an excellent and fun process, but it makes it the care that we provide that much better. The quality that we give is, in my opinion, bar none. We've got an amazing physician, Dr. Green, but we've also got a ton of other people who really care about this work and are just as passionate. So our team right now is small, but it's mighty.
I love it. I love that. I love hearing about what you do. It's inspiring, number one, and it because in my mind, especially being on the west side of Chicago, I know Justin earlier said something about him being in DC and having people that look like him be his healthcare team. For me, I didn't see that. I didn't see it. I didn't know that it existed. So to know that it's here, that's so awesome to me. What we're gonna do is gonna go take a quick break. So we're gonna go to break, and we will be back with Dr. Green and Nurse Welch. See you when you're back.
What's up, everybody? Welcome back to the Sexual Health and Wellness Agenda. Y'all know we've been having a time full of laughter and love and learning. You can't get better than that. However, I feel like, it's time to actually get a little more fun and personal with it, because y'all have such great big personalities, especially in the work that y'all do. It requires that, right? Because people have to connect with y'all, and you have to feel safe with you all. However, I want to know a bit, more personal things. So this question's for the both of you. What's your go-to self-care routine? Your self-care ritual after a long, stressful week? Because doing what y'all do, everybody can't do it. However, what does self-care look like for y'all?
For me, self-care looks like a lot of different things. It's not just one thing for me. Self-care can be calling my mom at the end of the week and chatting and running her through my crazy hectic week. It could be calling Dr. Green and talking about the things that we experience. And for me, that's very therapeutic in itself, because I'm like, oh no, I'm not the only one who's like, this is crazy, right? So, but oftentimes, I'm like a introverted extrovert, so I like to go out and have a good time with my friends, whether that be going to brunch or doing, going to a museum or doing some stuff around the city of Chicago, going to a bar sometimes. But yeah, for me, it looks like many different things. But hopefully, a vacation soon is what I'm looking forward to. That's definitely vacation.
Yes,
Yeah,
God,
We love a vacay.
give him a vacay. But it sounds like community is like a big source of your self-care, and that's important
absolutely.
because dealing with what you're doing, being able to lean on those who you love and support, it makes a big difference. So that's cool. Yeah, thank you for sharing that. What about you, Dr. Green?
I like to get really into a series, it's okay for a cartoon series, an Arcane, a suit, or
Yes, come on, Arcane. That's my.
You see what I'm saying?
Yes. You just made me happy. You made me excited when you said Arcane. I was like, yeah.
all the cartoons.
The drama.
I like to. I have a dog and I have a cat. Which means I'm single. But but I like to spend time with my family, my tribe. I have the dopest tribe ever. My family, my friends, and I encourage everybody to get you one of these. Surround yourself with people that are going to uplift you. And complete you. And they don't have to be a lot of people look for, significance of others, and they're cute and they're great. And especially times like these, you want somebody you can turn to and be like, today was really hard, At the same time, for those of us that have tribes and stuff like that, to pour into you, so that you can go and stand up and stand in and do all those things. That's not, you that support is there. So I like to spend time with my tribe. And I'm also, oddly enough, I am an introvert. So after I'm done peopling, like what y'all saying here, y'all like, oh, that's cute. It's gonna be 2 days being by myself like this. Okay. Okay. Yep. And then because it's our passion, I know both me and Eric, some of the stuff. I mean, Eric's on here like we connect on the phone. It's a whole key.
It's a whole key.
Like it's a whole key, but it's also what comes out when we're in our downtime is ways we can build structure for the community still. Like, in the midst of all this, we should do this and on that. So yeah.
Come on, Soul Tribe. I actually I stand by that. I stand by that because I feel like platonic love is the deepest form of love anyone can experience. And to have people who see you and love you for who you are, that's just it just makes it easier. It makes it easier to go through life because we cannot do this all alone. And I agree. I'm actually about to go to this question because you actually made me think about this because you said that you were single. However, I want to know this, y'all. I got to know this. What's y'all vibe when it comes to dating? Are you more of a hopeless romantic, a practical realist, or something in between? Give us the tea.
In my head. What's sexy to me is who know how to go build community and sit the hell down. No, I don't like a lot of drama in my home and stuff like that because what I do on the daily requires a lot of being aggressive or things like that. So when I come home, I cook a lot. I cook for my family. I cook for my friends. People gonna get a pot of, they gonna get some greens, okay? Whether you want, you gonna
Amen.
get
Every
some
time.
Amen.
you know, and I do that, but also what also seems to pan out that is a working opportunity for me is, y'all, I be out here stupid. Like if I like her, I be stuck, you know. So that's one, you know, opportunity for me. But what I love is somebody to know how to sit down, has a spiritual life, you know, and it's about community. Yeah.
You said knows how to sit down.
Yes. I mean, not a lot of unnecessary drama, you know, in our community. I think part of it, some of us are just ourselves. A lot of us, whether it's Black community or gay community, a lot of us take on these assigned roles that other communities have given us.
Mm-hmm.
You know, so if they say we messy, we think we got to be messy because that's what they glamorize on TV and stuff like that. Now and in this season, we have to have each other's back. I'm talking about the LGBT community.
Yes.
The T will never be out. Okay. You know,
Say that again.
the T will never be out. You know,
Never.
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 And we have to stand up for each other. And because of the way society has taught us to think about ourselves, if you're out there and you're thinking bad thoughts about yourself, another journal, 2013 Journal of Clinical Infectious Diseases, Black men who are diagnosed with HIV get diagnosed later. And once they know their status, they get medicines later. And they stick to those medicines eventually later, especially if they were raised in an environment that's super religious, not spiritual, super religious. How they should feel about themselves. So bringing that up to today, the ostracism and self-stigma that you might have, you have to be careful what you say about yourself, whether you say it out your mouth or whether you say it in your head, because the first person to hear it is you. Because when you talk about yourself, you're also listening.
Come on now. Come on.
No, that's real.
Real quick before we go on, something that you said that kind of stuck out to me is we all have to be together, right? And also we have to, as a community, and how the T will never be out. We've talked about it a couple of times on this podcast before, just the fact that I feel like we are very disjointed as a whole, right? Gays and lesbians and trans and gays and trans and lesbians. Well, I mean, I'm pretty sure I know the answer because all answers go back to whiteness and white supremacy and the patriarchy.
Patriarchy,
Outside of that, I guess, why do you think there's so much decision amongst the community, the LGBTQ community, and why do we rarely cross those lines and, you know, work together, commune together, party together, celebrate life together, exist together? Why do you think that is?
That's a hard one. I think that I think we put up these barriers, or not we, but society puts up these barriers that prevent us, that make us more divisive in general. You know, we're seeing it right now, right? And unfortunately, I think there's a lot of misinformation, a lot of disinformation, and you know, folks don't always feel comfortable intermingling and crossing, you know, those lines, and you know, the intersectionality of being Black, gay, Latin gay, or whatever your intersection is. I think it also comes back to safety. Do I feel safe with these people? And we, unfortunately, society doesn't create enough safe spaces for all of us to want to always intermingle and be together in community. I know who I feel safe with, but that may not be who you all feel safe with.
That's true.
Maybe though, right? So, and I think conversations like this is how we wake it up, you know?
Yes.
But yeah, there's a lot going on in this world right now. And so I think safety just has to be at the forefront of everyone's mind, whether it
Yes.
be, you know, safety, physical safety, or safety in your job, safety in healthcare, right? Can I tell my provider, who may not look like me or not have the same political views as me, you know, everything I've been doing, and will I get the same
Mm,
care?
that
And
The
judgment.
judgment
yeah,
Yeah.
from we've
Yeah.
seen healthcare professionals, you know, use judgment with their patients. So I get that. Yeah.
The
yeah,
assumption of promiscuity is there, always there. Whenever I just, every time I go to the doctor about something, that it's almost like, especially if it's something with your, you know, sexual organs or anywhere in that region of your body. If you say anything is anything, the first thing is always is, you know, it's an STD. It's like, well, no, it could be something. There's many other things that it could be. Why are we going there first? You know what I mean? Like,
Right.
it's always that air of promiscuity, and I wonder if that's the same direction that you're going when it's somebody else. You know what I mean? Like, is it because of
Yeah.
me? Is it because you know my tea because you asked me them questions? Is it because I'm black and I come in here, so you automatically assuming that it's probably sex related? You write me off and it could be something else. You know what I mean? So that's huge what you just said.
and I
And
think that's also what. Oh, sorry. Go ahead.
oh no, it's okay. I wanted to, before we move on to the next session, Eric, I wanted to know your answer to that question that I asked Dr. Green.
What was the question? I'm sorry.
Oh, you
okay. So let me
with
tell you. Let me tell you. The question is, what's your vibe when it comes to dating? Right? Are you a hopeless romantic, a practical realist, or somewhere in between? The girls want to know, and I'm the girls.
All right. So I would say that I am somewhere like in between. I think that, like, for me, like, you know, I want all the things, all the romance. I do want all that, but like, I think I'm very rooted in reality, because I have to be. And you know, when I'm looking for a partner and or dating, I like a mixture of all that. Yeah.
Okay.
Does that answer your question?
That it does. It kind of does. I'm gonna give you a little pass. But
Okay, I can do a follow. You do a follow when you what?
Oh no, I was gonna say, like, you know, because you said you like you like a balance, right? I guess I was gonna ask you, like, what are some like specific qualities that you look for? Because, you know, Green mentioned like some specific things. I want to know what are some like qualities or specific traits that you look for or that you want to attract in like a partner.
I would definitely say honesty first and foremost. Um, that's huge. Just someone that I can trust. I think with my unique experience working in healthcare and having my own lived experiences, with health issues, like, I need someone who I know is going to hold me down through anything and everything.
That's
Like,
real.
you know, the glitz and the glam, and, you know, you look good, you look great, whatever it is, that's awesome, right? That only gets you so far in life. So for me, you know, when I'm down on my last, and I'm not talking about necessarily financially or anything like that, but when I'm down spiritually, do you got me? That to its core is like where I hold the bar.
I love that.
Come on, Eric. Everybody come now. I'm finally there. When I'm Eric.
Yeah.
Well, thank y'all for the segment. I'm definitely gonna pass it on to Michael B now.
Yeah, thanks, Justin. So, all right, so we all know that America showed us who she was back in November. So now we are in a predicament, right? And we're in a predicament where this current administration, he who shall not be named on this podcast here, he's 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 rolling back a lot of protections for LGBTQ plus individuals and healthcare. Just not healthcare and everything, really, but we're going to specifically talk about healthcare. How do these policies change? These policy changes affect the Black LGBTQ plus communities, and what are some of the challenges that you all are already experiencing? You know, at ground zero.
Hmm.
I think most first thing that comes to mind right now is just is access. They're actively stripping access away from folks who are a part of the community, and it's impacting lives already. It's impacting programs that are grant funded, programs that are they shut down the CDC website. So for HIV. So it is um, it's impacting I think everyone who cares about this work and who's invested in this work in a real way, and folks who are living obviously with HIV and with a host of other issues in a real way.
When you said they shut it down off of the CDC, for those who may not know, what exactly does that look like?
So actually, right before
We're
we
laughing
started this
because
podcast, me and Maya were talking, and I was like, "Here, let me type in." I typed in, HIV.gov, and it said page not found.
Wow.
What?
Yes. So page not found. That there's no information there. So, and what that's doing is it's breaking down access to information and education for folks to
Wow.
even know and learn about it if you chose that avenue. So
Wow.
yeah, it's scary. These are scary times.
You have anything to add at all, Dr. Green, to what he just shared with us?
yeah. So we kind of already, Eric, one thing that Eric and I have in common is, we don't like it. It's shocking how blatant and brazen they're being about it. But part of the reason why we both moved out of the positions we were in is because we've seen at these healthcare executive tables exactly who they are. So I'm not even
Surprise.
surprised, you know what I'm saying?
Yeah.
I'm more surprised at the direction that we as the rest of the community have taken. I'm not surprised at them. I'm surprised at every disease, including racism, has two things, right? What the disease wants to do and how we react as a human. Now we can talk about, as human beings, as people, right? And people, okay, so the disease itself, how we as a group of humankind react, right? And it's this one, how we react as humankind that determines how virulent or how well that disease is allowed to ravage community. Is not actually the thing. So taking it back to, so I'm not surprised that he's doing it. I'm surprised at how we're reacting. I'm surprised at how, that he wrote it in a 935-page document. We didn't read it. And now when it's coming out, we like, what? Well, it was written.
Yeah.
It's like fundamental. Reading is fundamental. So, and if you're not a person that can download all that and absorb it, that's why they got download and you control F and you search for the part that applies to you.
Not only that, I don't know if a lot of people know this or not, but let me put y'all on game to the listeners, right? When the whole Diddy situation happened and there was that 30-40 page court document, what I did was I downloaded it, went to my good Judy ChatGPT. I uploaded the document and I said, pull me out the key points from this case. And they gave me like 20 bulleted points. And I didn't have to read through the case. And that easy. So like you could do the same thing with like these different, and you should be paying attention so we know what the laws that are being passed. We know, the policies that are being changed. Speaking of some of these policies, I want to ask y'all, so if different funding, right? If funding gets stripped away for, HIV and all these other things, is that going to affect is that going to affect people's care? Is that going to affect testing for prevention as well as affect care? And if so, how as a community do we respond and react so we don't get to a place where we're reverting back to what was going on during the epidemic back in like the late 80s, early 90s?
I think it already has, right? I know. So tomorrow is National Black HIV Awareness Day, and there are a couple of areas where people were supposed to test, but their funding was cut, so they didn't have the resources, right? How do we react? Well, as I said before, I tried to find a way where I wouldn't be. I know my delivery of care didn't have to be beholden to that system, and then that way I get to care for my community. Everybody got some kind of relationship with some kind of religion or no religion or somebody's grandparent, blah, 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 blah. But for the most part, people have this idea of some being that they want to be like, I'm hard pressed to find religion, ideology, a social belief that does not have somebody that's willing to go to the blanking mat. You know what I'm saying? And every time we take that and we take only the meat, well, people give us and tell us to take only the meat things they did. Some people believe in God, some people believe in Jesus, and they say, well, what would Jesus do? Well, sometimes he will overturn tables because it's there. It's overturn the table and say, I'm being like Christ. Excuse me, boom. You know what I'm saying? You know what I'm saying? Get you a rider that'll cut off somebody's ear every now and then. I ain't saying cut off nobody's ear in real life. I'm saying sometimes you have to have people that will go to the mat, because as we see in politics, there are people willing to go to the mat to oppress you.
Yes.
And that's how intense you have to be about your freedom. And so sometimes you got to read what they're doing and prepare, right? So every time we take that and we take only the meat, well, people give us and tell us to take only the meat things they did. Some people believe in God, some people believe in Jesus, and they say, well, what would Jesus do? Well, sometimes he will overturn tables because it's there. It's overturn the table and say, I'm being like Christ. Excuse me, boom. You know what I'm saying? You know what I'm saying? Get you a rider that'll cut off somebody's ear every now and then. I ain't saying cut off nobody's ear in real life. I'm saying sometimes you have to have people that will go to the mat, because as we see in politics, there are people willing to go to the mat to oppress you.
Yes.
And that's how intense you have to be about your freedom. And so sometimes you got to read what they're doing and prepare, right? So a lot of times, something we did in Nexus, and Eric and I were talking, we was like, everybody that's here to stand up during this time actually went through a period of transition. Eric did too. Eric's we're both introverts, but Eric's more of an introvert. He probably over there put us all in the thing. Like, why didn't you see that smile?
You said show his face.
He was like, we went through a period of transition by design of whoever we believe in, for this time, because we needed to come out that system. So whatever they do, we're like, okay, well, we have these other streams that we built during this past 2-3 years that we gonna do what it do for people that want to get care, want to get medicine, want to get care from a physician. So, if you have insurance, great. If you don't, great. I bet you I won't ask for it, but I bet you I still see you and treat you, You know, and so yeah, I got my team there. They'd be like, "Thank you, Ray. It's just like if you would have given the opportunity to ask for this, you're great." You know what I'm saying? Okay, you do that, but guess what? That person's gonna get care no matter what when they walk in, whether they got whatever or whether they don't. It don't matter because guess what? Other cultures give that to each other.
Mhm.
We have to share the privileges that we have. We have to spread it amongst each other. Otherwise, it going back to that separatism. My stuff is mine. I work hard to get this. No, I work hard so my community can leverage my degree during COVID. I need a
Come
10.
on.
I need vaccine. I need testing. You want a vaccine? No. Okay, I need ways to keep them safe. You want a vaccine? Yes. You get a vaccine. I need all of that because my degree says I can have it, but really, I got the
Mhm.
degree so I can facilitate healing in our community. So even in these times, you know, you don't so we've seen that. Somebody said we've never seen this before. You've seen it in other countries that you call third world. You absolutely seen it. What are you talking about? You
I
just
mean,
started
we've seen it
happened to you
here.
because
We've
you got
seen it.
comfortable.
We've seen it. They haven't seen it. That's the
Yes.
thing.
Yes.
I remember when Trump first won the first time. Ugh, I said his name. When he first won the first time, I was working. I had a federal job at the time, so I was working with a lot of like different clear folk. And they were sitting, you know, the results started coming in and they announced that Hillary lost. And then like this white girl next to me was like, I can't believe this happened. America is so racist and I just can't believe it. And she looked at me and she's like, can you believe he won? And I was just like, yes, like my whole entire existence, this has been who America is. Even when Obama was,
Exactly.
even when
Like
we had a black president, like they acted like this man like gave the nuclear codes away when he wore that tan suit.
that tan
So
suit messed them up. Okay.
it had him in the chokehold. So it was like they've never experienced. This is all shocking to them, but we saw the writing on the wall a long time ago. They didn't listen. And that comes from people voting against their own interests, right? Because they see, I hate trans people so bad, and I hate gay people so bad, and I hate immigrants so bad that I'm gonna go vote for somebody who's gonna literally be responsible for taking my Meemaw's medicine. Right now, Meemaw can't get no more medicine. Like all these things that they didn't think was gonna affect them, now it's affecting them.
And then a topic for another one because you gave us our time. We almost out of time. But what about this? I hate myself so bad
Ooh.
that I'm willing to vote for this standard that somebody else gave to me, told me it was great. We literally watching them fumble every day. Super F. They walk around getting super Fs every day. You know what I'm saying? But we still hold them as the standard in our minds. We want to drive what they drive. We want to do what they do. We see them out kicking and stuff like that, and we want to be in those spaces, you know. And sometimes the space many times the space not made for you, so you have to go out, create your own space. Stop giving away your intellectual property. Stop giving away your talents to them, letting them absorb it and getting credit. I was telling, I don't know, Eric and I talked throughout the day, you know, a lot of times, and it's grown through. I think ever since I saw you in them streets during COVID, I was like, oh, you got that life. And we've just got close. I was like, I didn't know he's going to be in the streets. And he's out in the streets with the same smell like, hi, Dr. Green, what are we doing? But still about that business, you know?
Right.
I was, you know, some of my favorite things to eat is I love this peri-peri sauce called Nando's. And I turned today when I was making, I said, you know, I was making my own, you know, seasoning my own stuff, putting in the air fryer. And I said, you know what? I'm going to use this sauce as marinade. It was good. However, I said, this sauce so good and it costs so much. I'm going to make my own. Let me read the ingredients. I read the ingredients. They was cute. At the end of the ingredients, it said, born in South Africa, now made out of the Netherlands. Y'all better quit playing with me.
How do we get from here to there?
That's the global story that's going on right now.
That's so good. Oh, y'all are giving us so much. We got one final break, and then we're gonna come for the little last part of this. Everybody who's listening, I hope that you all are gaining something. I hope you are learning something, y'all. We've learned so much already, and I'm excited for the rest of this conversation. Make sure that you leave a rating and review. Leave us a rating, leave us a review. Let us know how you enjoy the show. Let us know all of the things, all right? And we will be back after this.
Welcome back, beautiful people, to the Sexual Health and Wellness Agenda. We have Dr. Green here, and of course, Nurse Welch. And honestly, the conversation has been so insightful and so inspiring. And honestly, we cannot let you all go without the agenda moving forward. And basically, this segment is for individuals, just to inspire individuals and to motivate them. And have a few questions for you too. What's a message you want to leave for the next generation of Black LGBTQ plus healthcare leaders? And any of you can start.
I'll start. I think the message that I would like to leave is be radical. We just talked about a lot of things and a lot of ways in which sometimes it takes getting to certain places to make change, but I think right now is the time to be radical or be what people consider radical. I don't consider radical giving healthcare to people who are in need, but that might be to some people. So if you are in a position to help someone, and it's safe for you to do so, take that step. It's time for us to step up. It's just time for us to step up. Boots on the ground. Yeah, that would be my message. And for anyone out there who is thinking about going into healthcare, we need us more than ever. There's been a great drive for Black and brown folks to get into healthcare, but it's not now is not the time to let up the gas, even though we got a lot of things weighing on our back. Press forward and be radical.
Or radicalism. Yes.
I love it.
Yes.
And I think I would double down on what Eric said. Also, stay prepared, stay ready. Know when this is not me. So what I'm gonna say these words do not belong to me. They belong to a great Maya called Maya Angelou. When people show you who they are, just believe them. Be ready for that. Don't be mad. Be ready. And when they try to come for you, don't be there. Be gone.
That's right.
Ooh.
That's good.
That is.
That was really good. I'm got speeches for a second. Oof. Got to take that in.
Be gone.
And the last question for you two, very heartfelt. If you could write a letter to your younger self when you first started in healthcare, what's the first thing you would say?
Peace be unto you, because you see, it's wild out here. It's wild out here, But again, I wouldn't, if I left this earth and I didn't do what I was called to do, I would be, not happy as an ancestor or wherever I'm, going. I wouldn't. That would be my own personal hell. I know what I'm here for. I'm here to do that, and I'm here to stand on it.
I would just tell myself the path is not going to be easy, but it will 100% be worth it. I wouldn't be sitting here with you beautiful people, and I wouldn't be connected to such a beautiful team that is Nexus and Onyx, and that give yourself time and and you will find your purpose.
That's amazing. I love it.
Real quick, before we do outros and everything, I just want to open space for y'all to kind of let us know, and let the audience know, let the listeners know, how we can support Onyx, how we can support Nexus, how they can get plugged into the work that you all are doing. Are there any initiatives, any time sensitive initiatives going on? Can you all just talk to us about that before we leave?
I can start off, Eric, if that's okay.
Yeah,
Sounds
so
good.
Say, you can hit us up nexusmedicalcare.com, or you can reach us at 833 Onyx, FORONYX, and just it also, we're not going to be the solution to the unnecessary plight of HIV or lack of PrEP in our community by ourselves, right? The person most qualified to impact your community, the people who sit at your table, is you. So there's information, and get the information, right? Why would they take that information down? Because it was a source for us to find out more to heal ourselves, right? So I'll give you some. 1.1 million people in the US have HIV. MSM, Black MSM make up 35% of that. And depending on where you live, anywhere between 1 to 8% of the population, but 35% of new diagnoses and people having poor outcomes, Black Americans make up almost half of the people with new diagnoses and poor outcomes. But the medicines for HIV have been so updated, we have not updated our conversations, right? So what HIV is, what HIV isn't, and now people with HIV live completely normal lives and are normal, right? I want to talk about U equals U and all that other stuff if I have time, but I know our time is going short, but I will tell you, how many times in history has someone who's living with HIV and taking their medicines passed it to their lovers, their babies, anyone else? Exactly effing zero. Because remember, I'm trying not to curse. I got things getting corporate jobs now. 0 times. 0 times in history has that happened.
Wow.
We live in a time when you look at HIV, it needs 2 things. It needs someone to give it and someone to get it. Now we live in a time where both sides of this equation can be impacted. If I'm not living with HIV, I can take PrEP. It's a medicine. We talked about Doxy PrEP, right? But let me tell you about PrEP. They was like, oh, the percentages for Doxy PrEP. PrEP is 99% effective if you take it as prescribed. You can take it every.
So if the partner without it, I'm going somewhere with this, is on PrEP, and the partner with it is undetectable, you're good to go, correct?
You're at U equals U. Exactly. Undetectable on both sides. So we can, in our community, in our spaces, that's exactly where I was going. Cut that blank off and where it stands.
Yes.
Right? So I also want to say you can love somebody living with HIV, right? Because there's PrEP, but there's also, I know people that one of them person has been living with HIV for 40 years. The other partner don't even take PrEP because they know the person is taking their medicines. They know the person is taking their medicines. They see the viral load, everything like that. But say you don't know, then you can get on PrEP, And so, and PrEP is a medicine you can take. It's a pill you can take every day, but now they have every other month injections. Same thing for treatment for HIV. You can take pills every day, or you can take every other month injections. So, and then coming down the pipe for both is the every 6 months injection, but you have to be undetectable, which means you have to start with the pill, get the virus down, and then you never spread it. So go ahead and love, go ahead and be yourself, be authentically who you are. We talked a lot about resistance on this podcast. That's an act of resistance, being authentically. Imagine if all those people in them blue suits was actually who they are. They can stop putting their foot under the bathroom stall and carrying on.
Tapping that foot.
You slide it to the other thing. No, slide your foot back and be who you are. Wait.
Wait, what's going on? Maybe happening with the feet.
You remember that? What you want me to tell you for real? You already know.
Yes, I want you to say for real.
So I can get their name for you. There was an elected official that got in trouble, and they was mainly preaching fire. Them be the main ones. You know what I'm saying? When Plies was saying all that, I was like, he probably one of us. Stop playing. But that be the main ones. He preaching all that other stuff. Got his foot, so it's a sign that when you slide, like if I'm in the stall and you in the stall, and I slide my foot under your stall, that means I'm here to play.
That cruising, Alex.
I don't know nothing about none of that. I don't know.
I don't know
So they-
that.
Like
they-
last
the
week
same
with
person.
Sniffies.
But it was
No,
the same person being a homophobe, but then sliding his
Wow.
foot on them, trying to get, you know.
Yeah. I'm glad you talked about the stigma, because there's a lot of stigma. Like every I feel like it's the trending topic, and people do it for virility and go viral and all of that. But like at least once a week on Twitter is, could you date somebody with HIV?
Yeah.
All of those things, and we talked about it before. There's such a stigma around it. What do you all? I know we're going longer, but what is y'all advice to people? How do we as a community just break that stigma? Honesty.
That's a big question. But I think one of the things is for parents or anyone who is, a guardian or have a niece, a nephew, and you have consent from their parents to talk to them, talk to your kids about sex. It starts there. Don't wait for the government or anybody else to teach your children. Like anything, we can send our kids to school and they can meet quote unquote standards, but real education happens at home. And for something that's sensitive and as sex and sexual health, if you learn it from, again, a safe space, which for most people, hopefully, is whoever their parent or guardian is, and you have that healthy conversation, you don't got to learn from your friend who heard something on TikTok or whatever. You know what I mean? Like,
Right.
like it starts at home, and just show your kids, the love that you would want them to receive. I think that's a huge part of it. Education and really just learning from a very safe space.
Can straight parents teach their gay children about safe sex?
Absolutely. Yeah. As long as, I think there will be some blind spots. I think there'll be some blind spots, but they can absolutely teach their children about how to have sex safely. As long as they educate themselves and seek out the proper resources. Yeah. Maya, I don't know, what do you think?
I was just thinking, how do I tell them that everybody out here having anal sex if that's what they're talking about? Everybody. It might be some blind spots, but they ain't one of them. They're given on both sides. If you're talking about, heterosexual couple, both of them getting anal. Look, I do this for a living. Stop. Other than that, what Eric said.
Amen. So we want to definitely be able to support. So we're going to make sure that we get all your links. Are there any specific initiatives that you all have, or is everyday an initiative?
Every day is an initiative that we have. Yeah, we are available 24 hours a day. There's a call service, but we aim to get you in with an appointment as soon as possible, absolutely within 24 hours.
I love that.
Oof. Look, that's amazing.
It's a non-judgment. Oh, go ahead.
And you said that's with insurance, without insurance. All right, I hope y'all are listening to this, because so many people skip going to the doctor because they don't have insurance.
They
Insurance
sure do.
is not required.
Yeah.
I love that. All right,
So I was.
Oh no, you go, Dr. Maya.
No, I was gonna say two things that Eric came up with. Actually, I was like, "Oh, what do we say? Confidential, blah blah blah." And Eric was like, "That's cute." But I took what you said, and I just updated it to complete compassionate care, because that's what we do. I was like, "That is what we do. That is what we do." And then you see how Eric's like, that was what you said. Just 5 more things. I just want to put.
And confidential. I want to lift up confidential, because stigma We just had a whole conversation about it. But
Alliteration.
Right.
Confidential.
yeah, so you know, for
Harassment.
individuals who are worried about being outed or anything like that, this is a safe space. We just want you well.
Amen.
That's it.
So that means DL friendly.
100%. 100%. 100%.
No, for real,
And
for real.
you know, and DL friendly. This is not just for men. This is for women as well. Black women are being impacted by HIV at an alarming rate as well. So this is for anybody and everybody.
I love that.
Y'all heard it here first. Well, y'all heard it here again, but first him. Well, lastly, if you two are open to share, where could people find you on socials to connect with y'all? Because y'all have some great things to say. If people maybe have questions or just want to, be in community with you two. So,
our personal socials are
whatever you feel
All the
comfortable
above?
sharing.
Whatever you're
Oh,
comfortable
Whatever you
giving.
want, whatever you're comfortable sharing.
Yeah,
well,
whatever you're
I'm
comfortable
gonna
sharing.
lift up nexusmedicalcare.com, and I'm gonna lift up our Instagram as well, Nexus Medical Care. You can find us both on those. You may see an ad or two on Sniffy's, Jacked, some of the other apps. Yeah.
Perfect. And of course, y'all know you always can find us at the Black Gay Agenda. Find me at the Justin B. Smith on Instagram, Facebook, LinkedIn, TikTok, all the above.
Come on, LinkedIn.
You can find me at Dr. Maya 100 on Instagram. I was debating saying it because I don't be on Instagram like that, but that's where I am. If you want to connect, and Maya Green just on Facebook, and then Maya Green on LinkedIn.
Love it. Alex.
For me, I am on the socials. You can find me at XANDERT82. That's Instagram. That is TikTok, and now Blue Sky. I got my my page updated now, so I'm on there too. So you can find me at all those places. Yeah.
Cool. And you can find me at It's Mikey B on TikTok. It's Mikey B on Instagram, Blue Sky, Twitter. All of the things. Same handle. All of the platforms. So check me out over there.
Okay, now I feel left out. I'll
Are you gonna grace?
I mean, you ain't got look.
Personal.
Listen, Eric, introvert. Eric, like, well, what if they say something? Then they
Look.
Fine.
I understand, Eric. You don't want the fans to get in the DMs. I get
You
it.
know, I see them Asian fans. He got Asian in his family. He got Asian in his family.
They go see that recent gag.
I'll share my Instagram. My Instagram is eric.josephw.
Thank you.
Mm-hmm.
Thank y'all for sharing that. But honestly, from the bottom of our hearts, thank y'all for taking time and energy and creating space on our podcast. Everything that you two have listed and said has been extremely valuable. And, it's imperative, not only now, but throughout history, that we are on top of our game when it comes to our health and being aware of our health. And so thank you two for coming on here. And of course, our listeners, thank y'all for tuning in tonight. With that being said, grab your purses and clutch your pearls. This is the Black Gay Agenda. I hope y'all have a good night.